This podcast is for entertainment purposes only and does not substitute for professional medical advice. Please seek a medical professional or healthcare provider if you're seeking any medical advice, diagnosis, or treatment. Thanks, everyone.
Hey, Cotards. Cotard syndrome.
Welcome to our first episode on our spooky season.
Yeah.
It is, I cannot believe it is almost October. Yeah. Well, we record these.
Right now it's September 20th, but this will be coming out on October 21st.
Yes.
So I hope you are having a wonderful spooky season fall.
So far, yeah.
I envy you all that actually have fall, seeing the changing of the leaves. The weather is a little crisper.
Julie has her fall hands. I actually have some fall hands too.
Yeah.
And we're kind of dressed up a little bit fallen.
Yeah. And it's in spirit. Right now, fall is just falling rain for us in Miami.
Falling rain.
Doesn't stop falling rain. But
Yeah.
anyway, yeah. And our colors don't change. It's hot as shit. I can't put a pumpkin out there until like the day before Halloween. If I put a pumpkin out there, last year, we did like these jack-o'-lanterns. And I'm like, 4 days before Halloween should be close enough, but they should last. They should.
Yeah, no. I know. Our pumpkin died in like 2 days.
Oh my God. That thing was like.
Yeah. Like it had like liquid in it. I was just like,
It's disgusting. I was like, no, this is obviously not gonna
I can't wait to
happen.
do our pumpkins, do
Yeah.
some pumpkin patches, but pumpkin patches here are so hot.
They're hot as.
Yeah, they're terrible.
Yeah, it's really bad.
It's actually really beautiful because it's like as close to the fall as we're gonna get.
Oh yeah,
But,
absolutely.
But it is really, really hot.
It's so hot to go out in those fields and whatever. Anyway, but yeah, hope you guys are having a wonderful one.
Yes.
And to start off our spooky season, we're gonna be talking about something that's a little spooky.
Yeah, it is a little weird. I tell Julie all the time, I learned so much from this show. Because these are things that I did not know existed.
I didn't know that this existed until very recently, and I was like, this is wow.
This is weird. Yeah.
But it's real, obviously. That's why we're going to talk about it. And it's called Cotard syndrome.
Yes, which is basically you think that you are. Can I say that? Basically, the walking body belief, and you're just not living.
Your heart's not pumping, all those words. Unfortunately, we're trying to not use deprioritized words because this could be obviously an episode that would be heavily deprioritized if we use such words. So we're trying, guys.
Yeah.
It's, what can we do? And if you're on YouTube, you'll see a lot of like what I mean in the form of GIFs.
Yes. Perfect.
So there we go.
Great. So jumping into Cotard syndrome, jumping into it. We are jumping into a lot of things. I keep saying that. All right. So imagine believing that you're a walking body, that you
Lifeless.
no longer, you're lifeless, you no longer exist, or that your organs are completely gone. It's kind of creepy.
It's very creepy.
I can't. That's so creepy.
That's what they believe.
Yeah. So it's that really creepy fixed belief, okay, that it exists and is known as Cotard syndrome, sometimes called the walking corpse syndrome. It's really rare, but it is a psychiatric condition in which people hold fixed false belief that they are no longer alive, they are deteriorating, or do not exist.
Like simply don't exist. Yeah.
Yes. These are not hallucinations. It's not like you're having an acute psychosis and you think that.
Right.
Or it's not a supernatural belief, but a deeply convincing false thoughts about one's own body. And people with Cotard syndrome might insist that they lack blood and organs or even a soul and that they are immortal. They may withdraw from others or neglect hygiene, refuse foods, and even refuse medical care because they just don't feel like they are alive at all.
Yeah.
And despite sounding like a horror story, Cotard syndrome is a recognized, though very uncommon, medical phenomenon. Now, history. That's you, boo.
Yep. Where did this come from? Because I'm like, how?
Yeah.
Why? Anyway, so came from Jules Cotard. Surprise.
Jules.
Yeah.
Turning.
Oh, yeah. I hadn't even made that connection. Yeah. Anyway, so Jules Cotard, first formal description. And that was in 1840 to 1889 when he was living. And he was an actual doctor. He was a French psychiatrist and neurologist. First formally described it as Cotard's syndrome. At a meeting, this French, I'm not French. Okay, so I'm going to try.
I think it was just the medical society.
Yeah,
The
so
French translation of medical society.
That's pretty much it. And it was in Paris. And
I think it was the the Medical Society of Psychology.
Yeah,
I think that's the translation.
Exactly, to English, obviously.
Yes.
And it was in Paris, and it was in June 28th, 1880. He presented a case of a 43-year-old woman, later called Mademoiselle X, suffering from severe delirium of negation. So she was saying like she was denying her organs, her body parts, sometimes even her soul, insisting God and the devil did not exist, like just that everything did not exist, including herself and her organs and whatnot. She claimed that only skin and bones remained. There was no chest, no brain, no intestines, like nothing. Okay, so it was just like a blob, I guess, is what she envisioned in her mind that she was. She believed that she was immortal, or at least could not pass away from a natural unaliving. Eventually, she lost her life from severe food refusal because she thought she didn't need to eat because of that. So that was back then when he presented this case. So a large analysis of 100 reported cases, and this was by Barrios and Luke in 1995, refined what signs are most frequent. So for example, 86% had nihilistic fixed beliefs about body parts. So when we say nihilistic, it's like the self, you know? So 69% about existence and 89% depressed mood. And they looked at factors like age, gender, diagnostic categories. And then in the more recent case reports, some include unusual precipitating causes, like, for example, medications or neurological illnesses. And they could even occur to younger patients, right? So it's just like, it seems like it's like it comes from an onset of something else, you know, unfortunately. So why this history matters, and also why it's a little entertaining. The original case, that Mademoiselle X, she lost her life from this severe food refusal because she genuinely believed that she had no internal organs. So therefore she just didn't need to eat because of that. It was grim, but it was real. In a historical context, Victorian and early 20th century psychiatry was deeply interested in melancholia and also in spiritual despair and hypochondriacal, like, fixed beliefs. Like, the Victorian era was full of all of that. So Cotard syndrome came partly from the intersection of like religious and spiritual belief systems, but with a medical understanding of the body, moral and religious guilt, you know, things familiar to people, at least in those times. And the evolution of this medical thinking from this melancholia to this hypochondriacal, like, delirium of like organs and something, you know, more medically related like that, to just like negation, and to now what we know it as Cotard syndrome, shows how naming and classifying mental illness matured, you know? So it went from like all those stages. And the language terms and the understanding changed with medicine, neurology, psychiatry, and brain science as it advances. So yeah, it's just interesting how in your brain, like if it's going through a neurological situation, that we will talk about, like how some neurological like syndromes or diagnoses or whatever could bring about this, how that in a physical level could then bring about this in a psychiatric level. So it's really interesting.
Yeah. All right, so let's talk about symptoms and consequences. The hallmark of Cotard's is the conviction of non-existence. Patients may believe that organs, limbs, or even blood are gone, or that their brains have turned into dust. Some insist that they themselves are no longer alive, or that they themselves are immortal. Now, these beliefs are often accompanied by profound low mood, anxiety, guilt, and paranoia. And that's when I, like reading about this, I felt that you have to be in such a bad state of depression.
Mental,
that you're kind of just like gassed, like you're empty. You don't have anything.
Right.
Right?
Right.
So I can see how this was associated with such profound low mood. And because the patients truly feel empty and not alive, they often refuse fluids, food, and self-care. And we see this even, in patients with anorexia, that they stop accepting foods. They stop accepting foods. And then that leads to a malnutrition. And if you keep on following that, the complication is going to be, well, your brain can no longer make serotonin because we don't have the nutrients to get it to make it.
Right.
And all these other hormones, right? It's like this vicious cycle that gets worse and worse and worse. And they just stop eating completely. Yeah.
Yeah.
Severe food refusal and rapid weight loss are really common in this syndrome, and sleep can also be abandoned, and hygiene is also neglected. And the syndrome really carries a high risk of self-directed harm and fatal outcomes as well. Some patients feel that ending life is merely matching their belief of non-existence because of these dangers, and early recognition of psychiatric care is like really critical for this.
What causes this and what brings this about in the brain, right? No single cause of Cotard syndrome is known, but it almost always occurs in the context of another brain problem. Severe mood disorders, major depression or bipolar disorder often underlie it, as do neurological diseases, for example, Parkinson's, Alzheimer's, stroke, or brain tumors. In other words, any illness that severely disrupts that self-perception can trigger like a Cotard type of fixed belief, and there's ranges of this. Some people have it that it's just certain parts of them don't exist, and then there's other people that their whole self does not exist. So there's several layers to this. Research hints that the right hemisphere of the brain is often involved. Neuroimaging in Cotard's patients has found abnormalities like lesions or atrophy in the right hemisphere regions. So there we're seeing how the neurology affects the psychiatry. Some of these theories suggest a breakdown between facial or body recognition areas and emotional centers. For example, disconnection between the fusiform face area, so that's just what controls a part of your face, and the amygdala, which is your emotions and whatnot, could make one's reflection feel unfamiliar. If you can't emotionally feel your own face or body, you might literally feel like you're not alive.
Yeah.
In one Mayo Clinic series of patients, the majority had right-sided brain changes, supporting the link between Cotard's and disrupted brain networks of self-awareness. I don't know, that's very interesting, how you could look at yourself in the mirror and not recognize
yourself.
certain parts of yourself.
Yeah.
That's creepy to me.
It's so creepy. No, it's so sad.
Yeah.
Who are the people that are usually affected? And we're really going to focus in on the prevalence and what are the risk factors. So Cotard syndrome is really, really rare. And estimates from psychiatric hospitals suggest well under 1% of patients have ever had it. And in one study, only about 0.6% of the general psychiatric inpatients and about 3.2% of severely depressed older patients met the criteria. And these rates are already in a high-risk group, and the true number in the general population is likely even smaller than that. Reported cases tend to cluster in middle age or older adults. The average age is between 50 to 60 years of age. Women appear slightly more than men, and as is common with major depression. Now, children and teens are very rarely affected. It tends to strike later in life and often when another serious illness is present. Despite its horror movie appearance, Cotard syndrome can respond to care, especially if it's begun quickly. Again, I think Cotard syndrome is just such a severe late stage form of depression, and it's just very rare to feel those symptoms. But if you really think about it, depression is not rare, right? However, seeing this complication of that emptiness of no organs and everything like that, that's very specific. I can see how it's very rare, but it's that late stage. But again, we've talked about in the past, depression, what we can do to help and things. If you really start therapies and that treatment plan from the beginning, you probably can avoid all these things. So first, doctors address any underlying illnesses. You always do that. For example, treating low mood or correcting metabolic problems. If you have a thyroid problem and you naturally feel down, you're going to want to correct that. And then psychiatrists usually prescribe a combination of medications, antidepressants for moods, and atypical or typical antipsychotics to stabilize the mood, maybe for fixed beliefs. And in many severe cases, electroconvulsive therapy has been life-saving. One review noted that Cotard's patients seem to be most effectively treated by electroconvulsive therapy. I'm just going to say ECT. ECT often produces marked improvements when medicines alone are insufficient. Some modern case reports highlight specific medication combinations, for example, an antipsychotic like maybe olanzapine, paired with an SSRI, which is what we usually use for, anxiety and depression, like fluoxetine, has been used successfully. And as care takes effect, patients typically begin eating again and slowly regaining insight. And the unusual beliefs gradually fade as the mood and cognition start to normalize. Recovery can be fragile. Without strong support, patients can relapse or neglect themselves again. And once they're stable, most patients recover their will to live and no longer hold the walking body beliefs. And prognosis today can be good if the patient receives prompt psychiatric care, which Jules is going to touch on.
Yeah. I mean, you could definitely see how this is like
really, really severe form of depression.
Of course, like how...
And it has a lot of similarities.
Exactly.
For refractory depression that's failed multiple treatments and therapies and things like that, ECT has been shown to really be effective for these people that feel like they don't have a lot of options left.
Exactly. Check out our episode on that. We did do an episode on ECT. All right. So recent research and cases. Interest in Cotard syndrome has grown slightly in recent years through case reports and small studies. For example, Stewart and colleagues in 2022 described Cotard syndrome emerging after a COVID-19 infection, suggesting that severe illness or brain inflammation might trigger it in vulnerable people. Again, we're seeing that neurological landscape of if there's something physically wrong with the brain, especially in that right hemisphere, it might trigger something like this, which is kind of also discussed in depression too, certain
MRI changes that you can see.
So a 2024 review of cases emphasized how difficult the condition can be and supported using combined treatments like how she said, antidepressants plus antipsychotics plus ECT. A larger 2018 analysis from the Mayo Clinic, 12 patients underscored that Cotard's appears alongside many different diagnoses and brain lesions. While still a clinical rarity, each new report helps doctors recognize and treat this walking body belief more effectively. Yeah. So, mental health is real, guys.
It's very interesting because these are such rare. Obviously, we study depression. We study things like Parkinson's.
Yep.
And, these are all diagnoses that unfortunately are more common. And so it's so interesting to learn about these more severe cases of people that have such profound symptoms of maybe anxiety and depression that they have some changes in their actual anatomy of their brain that would make them more at risk to develop this Cotard syndrome.
Yeah. And it's crazy how your whole brain can trigger, not even your whole brain, how certain things in your brain could trigger something so profound. Of your whole existence. Really.
Exactly.
So anyways, hope you guys liked this little spooky little tidbit of an episode. Catch us next week for our Halloween episode.
I know.
I'm not going to let you know what the case is. I'm not going to let you know what we're dressing up as. Yes, we are going to be dressing up as something.
Jules always makes me dress up. I'm like...
So stay tuned for that, especially on YouTube so you can see us. So subscribe, comment, do all those things. Also, we're on all forms of social media as Funny Medicine Podcast. If you're not into social media, it's funnymedicine305@gmail.com. Also follow her. She is now on socials. What are your...
Dr. G Peds. So Dr.G.Peds.
On Instagram and TikTok.
Dr. G Peds. You'll find me. We collaborate on pretty much everything.
Exactly. Yeah. If you follow our pod on all forms of social media, you could easily find her.
Yeah.
And then I'm Jules_Kaz, and we'll see you next week.
Bye.